Welcome to cardiac imaging at St. Francis Hospital and Heart Center in Roslyn, New York. I'm Dr. Jane Chow. I'm the Director of Cardiac Imaging at St. Francis Hospital, and I'm the Director of Cardiac Imaging of Catholic Health System. First, I'd like to briefly introduce our multimodality cardiac imaging service. We have a busy echocardiography service, which includes advanced echo supporting structural heart and intraoperative evaluation, with a busy nuclear imaging service, including SPECT, cardiac PET, as well as pyrophosphate scan for the evaluation of amyloidosis. We have a very large cardiac CT service that offers evaluation for coronary artery disease that is coupled with CT FFR. We support structural heart, EP procedure, as well as congenital heart disease evaluation. We have an advanced cardiac MR program, which offers comprehensive parametric mapping, including T1, T2, and T2 star mapping. We also offer stress cardiac MR perfusion. Today, in January 2021, we have 14 dedicated cardiac imaging cardiologists in our service, as well as 4 PhD level engineers who support our research and our clinical service. We also have a advanced cardiac imaging fellowship program where we train our fellows in cardiac MRI, cardiac CT, and structural echo. Welcome to St. Francis Cardiac Imaging YouTube channel. We want to use this platform to share our experience. You will expect to see videos that is reviewing latest literature and guidelines encompassing all cardiac imaging modalities. We want to make sure that we deliver our didactics in a setting of clinical relevance. So you will expect to see a lot of interesting cases from our vast clinical case collections. We will also use complex cases to demonstrate the role of multimodality cardiac imaging. In the next few slides, I want to give you some examples of what you may expect to see in the future video release. For example, we will discuss cardiac manifestations of COVID-19 by cardiac imaging. Those 2 images are illustrations from a recent publication in this topic. Left case where we show dilated right ventricle with reduced right ventricular function. The right case, which is a patient who developed left apical thrombus. We will also discuss the detection of left atrial appendage thrombus by TEE versus by CT. Those are illustrations from our publication in this topic. This is an example of coronary CT angiography and CT FFR. In this case, there is a complex mixed plaque in the mid-left anterior descending aorta. There's probably about 70% stenosis. The FFR CT to the very right shows a decreased FFR value in this region of 0.75, with further reduced value in the more distal portion of 0.65, supporting a flow-limiting disease due to this complex plaque. We will show the comparison of coronary plaque features by CT and by optical coherence tomography, or OCT. Here is an example of a low attenuated plaque on CT, which is confirmed as a lipid-rich flag on OCT, which is the image in the far right. We will compare the evaluation of cardiac amyloidosis by cardiac MRI and by pyrophosphate scan. In this case, there's extensive hyperenhancement of the gadolinium in the left ventricle and the right ventricle and in the interatrial septum, shown in the left image. The middle image is a T1 mapping. There is a significant increase in T1 value and also in extracellular volume in this case. An image on the right is a pyrophosphate scan. As you see where the arrow pointed, there is significant uptake of the nuclear trace. So it's a positive pyrophosphate scan, therefore supporting the diagnosis of ATTR subtype of the cardiac amyloid. We will also discuss the evaluation of mitral regurgitation by echo versus by cardiac MRI. At St. Francis Hospital, we have a large structural heart program. Therefore, imaging for structural heart intervention is an important part of a practice. In the future videos, we will discuss multimodality approach to pre-procedural evaluation as well as post-procedural assessment of complication. We will share our 3D printing experience, the software, the hardware, and more importantly is the clinical experience, how we use 3D printing to enhance the diagnosis of complex disease. In addition, we also use 3D printed model to assist in the pre-procedural preparation. So if you like what you see so far, please subscribe to our channel and also follow us on Instagram and Twitter. I hope we will see you very soon. Thank you for watching.